Welcome back to Charter California Edition. I'm Brad Pomerantz. We are now joined by Mark Uffer. He is the regional CEO of Prime Healthcare, which is what?
Prime Healthcare is a healthcare provider made up of 23 hospitals now. We are in 6 states. We were started by a physician, Dr. Prem Reddy, originally from Victorville, and mostly in California,
Right.
and has expanded over the last several years.
So there's no doubt, sir, that your patients and other patients throughout California and the nation are a little, I'll say nervous about healthcare delivery as we march into 2014. The Affordable Care Act is the law. There's no doubt about that. The Supreme Court upheld it. President Obama was reelected. And so where we stand today is that every single individual is required to get health care or they face a tax penalty. Explain what that really means to you and me.
Well, it's a bold thing in general to say that every individual is going to have health care. I think when the president decided to go down that path, he opened a door that we weren't all sure how he was going to get us through that door.
Right.
But essentially, you have a significant. I think the best thing to do. Let's talk about insurance.
Please,
and how
obviously
how we have grown accustomed to being insured by as we've grown up. And you look back, and generally, if you had insurance, it was either through most of the time, it was through your employer, and that was just traditional HMO, PPO insurance. There's a significant population, 65 and older, that we call the Medicare population. That doesn't change. Those patients will still stay on Medicare. The bigger population, the ones that we're most concerned about, the Medi-Cal, nationally Medicaid, California Medi-Cal, that population is significant in California and significant throughout the United States.
And let's talk about the Medicaid, Medi-Cal population, because as you know, the U.S. Supreme Court did have a specific ruling on that issue, and what the court had said is that the Obama administration, or the federal government more specifically, could not force states to expand Medicaid in order to get additional federal dollars.
Correct.
Some states are not expanding. California is. They've accepted the federal dollars, and as a result, they are expanding the Medicaid pool. So what does that mean for Californians? What does that mean for Prime Healthcare?
Well, essentially what's happening is you're taking the Medi-Cal population, which California is a mature Medi-Cal population.
Right.
It's a mature market. Many states, for example, in Nevada, it's still fee-for-service Medi-Cal, meaning basically the patient is on Medi-Cal, they go to a provider, and there's a fee, and it's not discounted. It's just whatever the Medi-Cal state fee is, which is about $1,400 a day if you're hospitalized. In California, Medi-Cal is heavily managed. So you have these groups like Cal Optima, Inland Empire Health Plan, LA Care, Molina. They actually take that Medi-Cal population and they manage it, much like an HMO.
And what's interesting is we have faced a budgetary crisis in California, and our current governor has been looking to decrease Medi-Cal reimbursements. A court recently upheld his ability to decrease reimbursements, and you know as well as anyone that doctors are reticent to take Medi-Cal. Some are refusing to take Medi-Cal.
They don't want to take Medi-Cal because of the reimbursement, and often it doesn't cover their costs. And then you add to it the fact that you're trying to change the behavior of this population. This is not a population that grew up with traditional health care insurance. So they're not used to using primary care physicians. They want to go to the emergency room.
But that's really the key in order for the Affordable Care Act to be successful, as I understand it, is that we need to re-educate our population that the emergency room is not the first step. It's the last step. And so part of what the ACA is looking to do is, as I said, push people into preventative care, primary care. So that begs the question, as part of this underinsured or uninsured population, some will qualify for the Medi-Cal expansion. Others, though, may be able to enter what's known as the exchange system.
Correct.
It's called Covered California. That, to many, is the most promising, I guess you could say, especially for those that don't get insurance from employers.
It's promising. It's just untested
And unknown.
And unknown.
Right.
And so you have the concept is this exchange, this California exchange, will have tiers of coverage that the consumer can buy. And then you have the consumer that can say, well, I really don't want to be part of the exchange. I just want to opt out. Well, there'll be a penalty for that.
Right.
But unfortunately, the penalty will be so low that it's not a disincentive for them
We do
not
know
to get
that
insurance.
that has been a significant criticism, that the penalty is not enough of a penalty. Although, as I understand it, the penalty does ramp up, so it becomes more of a disincentive. But that being said, and really educate me and our audience, if you may, part of the problem for the small business person or the individual who doesn't get insurance through their employer is they have no bargaining power.
Correct.
With insurance companies. And we know the Anthems, the Blue Crosses, they have been engaging in double-digit increases for years on these folks. But if you're part of an exchange, the exchange is the actor that will create the bargaining power.
It's a broker, so to speak.
Right. And so are you bullish on this?
I think it's too soon to be bullish on
Fair
anything.
enough.
I think it's really important to watch this evolve, be a player at the table, be a participant if asked to participate. I know we're looking at some of the low-income health plans out there,
right,
trying to partner with counties and trying to determine, where we fit into that network.
You wouldn't bid per se to be part of an exchange because you're not an insurer.
We're not an
right.
insurer.
And so the providers don't participate per se.
Correct.
I do want to ask you, though, about a challenge we face in California, and that specifically is there is a dearth of primary care physicians.
Correct.
There are some counties that just don't get anywhere near the average that is expected by the federal government. I know in your background you had been a physician's assistant, a PA. I've had wonderful experiences with PAs myself. There are moves to empower PAs, nurse practitioners, pharmacists, optometrists to have more primary care responsibilities. I understand that Prime Healthcare hasn't taken a position on that specifically, but in a very broad sense, if I can speak to you, what is your notion of this idea that we need to empower healthcare providers beyond just the MD or the OD?
Well, the only way that the Affordable Care Act and the Obama plan is going to work is if you increase the network of providers. And because of the shortage of primary care physicians in particular markets, it will be no alternative but to have extenders.
And I know that you serve significant portions of the Inland Empire.
Correct.
And the Inland Empire has been specifically hard hit by a lack of primary care physicians.
I can give you a firsthand example.
Please.
Before I worked for Prime Healthcare, I did a little stint working at Colorado River Medical Center down in Needles.
Oh, so you know.
No primary care physician in the community.
None.
None.
Not
Zero.
one, but zero.
Zero.
Wow.
The closest primary care physician was across the river in Arizona.
What do you do, especially crossing state lines? Healthcare is such a tricky issue.
There is really no answer but to try to find extenders, either nurse practitioners or PAs to go down there. Obviously, those kinds of communities that are underserved are going to have extenders in order to survive. Telehealth is a big issue. It's something everybody's looking at. We were doing some of that. We were working with Loma Linda and with the county of San Bernardino to provide telemedicine coverage down there. But again, you have to have some provider on site that can actually initiate the contact with the telehealth providers.
What would you tell our viewers as we enter into 2014? How would you educate them?
Well, I think the biggest education I think everybody's going to have is that the emergency room is not going to be your place of primary care service. It basically impacts the emergency rooms to the point where they're inefficient. And I think that they're going to have to be open-minded about shopping for insurance. They're going to have to be informed consumers for the first time.
Clearly. Okay, his name is Mark Uffer. He is the regional CEO of Prime Healthcare. Thank you so much for all your insight. We really appreciate it.
My pleasure.
My name is Brad Palmer. You're watching Charter California Edition.